Stephanie, you're back with us today. You and I met at a course in New Jersey where I was teaching disclosure time reduction with Dr. Kirstein, and you ended up being a patient. So I kind of wanted to get an idea from you. So that was about 3 months ago. What drew you to actually having an interest in taking that course?
I actually had originally taken a course on TechScan in 2011, like as a newer graduate, and I was very interested in it. But again, I was working for another dentist. He was like, absolutely not. That's money not well spent, and it kind of just died from there. Fast forward, as I've been working as a dentist, my stress level increased in my life, and I found myself going from having occasional migraine headaches to having about 2 to 3 migraine headaches a month, constantly clenching my jaw, waking up with a clenched jaw in the morning, clenching my jaw while doing a procedure that I find stressful, behind my mask.
Sure.
Finding that I was getting like an atypical pain behind my right eye pretty much constantly. I started to inject myself with lidocaine in my left jaw and occasionally in like the right area where I would feel that migrating type of pain in my face. And
for the record, what do you do as a profession?
I'm a dentist, sorry.
Not every patient that just walks in says, oh, I have syringes and I'm okay injecting myself.
Yeah.
Okay, so go ahead, I'm sorry.
So, and over time, no matter what I would do, I cannot get rid of the headache. Usually lasts 2 to 3 days, even through sleeping. Like at first, the headaches would go away after a nice night's rest, and then it just progressively got worse and worse. So then, on top of injecting my face on a routine basis, I tried Botox, and the first time that helped a little bit. The second time I actually ended up getting a droopy smile because too much was injected into my masseter, and for a year I couldn't pick up the left side of my face. So that was in 2015 and 16. So finally I resorted to self-medicating through alcohol. And that helped. So unfortunately, chronically drinking alcohol led me to get an ulcer at the base of my esophagus. And, things just started steadily declining for me. And, and then it's a revolving cycle. Stress, depression, pain, stress, depression, pain.
Sure.
So
while we were in the course, you and I met you actually before that. I was doing a day course, and you had your bite, equilibrated, or there had been some modifications to the bite.
Yes.
Before I met you.
Yes.
And were anything used to measure like T-scan, or was it just bilateral manipulation into CR? Or?
Just more checking. I've lost a tooth on the left side.
Sure.
And I think all related to this in retrospect. I had a fillings done in dental school.
Sure.
I had prolonged it. I come from a very poor family, so
sure.
Dental care wasn't a thing that I received until I got to dental school. So I had a cavity on every single molar. All of those cavities were filled, and from the get, the one in the upper left molar was never comfortable. I ended up getting a root canal in that tooth by an endodontic resident in dental school. Then that tooth fractured, but we didn't know it was fractured, and I had a root canal done, and a retreatment through the crown. And during that time, the endodontist mentioned to me that he thinks the tooth's fractured and it's a goner. Had the tooth removed, had an implant placed. The implant never felt comfortable either. Had the implant removed under sedation. In all of this process, my number 14 tooth died. Had a root canal done on that tooth by an endodontist from the get-go because I didn't want to take the risk.
Sure.
Got a crown, and the crown was never comfortable. So that dentist tried and tried to, adjust it, but it seems like that tooth is always migrating down. And
Okay.
so, it's out of bite, and then it finds itself. It comes back down and finds a place to get stuck. So naturally, now I got worried that I'm going to lose both my molars on the upper left, and I'm scared to get an implant now because of the previous experience with an implant. So all starts me to lead to think, like, is the problem even related to the teeth? Was it ever related to the teeth? Or am I going to be one of those crazy people that loses all the teeth on the left side because they constantly have this phantom problem and pain? So that's what led me to relook into TMJ, tech scan, this
Sure.
sort of thing.
Sure. So while we were at the course, I ended up treating you, and we did DTR with you at the course. And I wouldn't say it was a miraculous that day everything started to click for you, but it did happen quick in the sense that I was on my way home from the course, and you're like, hey, I'm noticing all of these things. So, like, you can open wider.
Yes.
All right. You mentioned something about your neck.
Yeah, my neck, of course I'm always working like this, so I'm sure part of it, of course, is due to career and just job stress. But I noticed that now I'm able to completely turn to this side without pain. Also, when I open large, even though I still do have a click, which you told me that I have some sort of derangement going on that jaw, which is no surprise
Sure.
from all the treatment that
Sure.
I've had, opening wide, wide, wide. But I noticed that I don't get a mosquito bite. Like I used to get like a very sharp, intense pain if I opened very large. So I would not have a bagel, I would not chew gum, or do anything that would, or like even cautious about yawning because I will get like a shock to my face.
Right.
That has not happened since October.
And you mentioned that in the last 3 months you've had one migraine.
One.
How many migraines were you getting per week or month prior to us initiating the therapy?
I was at least getting 2 per month.
Okay.
And I thought maybe it was related to hormonal cycle,
Yeah.
but now I'm thinking it's just more stress, then I'm clenching, then it comes on.
Sure. Well, do you notice that you clench less then?
Yes.
After okay, good.
Yes.
Good. What does the technology mean to you?
I'm very excited about the technology. I mean, I need it. I need it for my patients. I have so many patients that that come in, and you just can't quite diagnose what's wrong with them. You take an x-ray, everything looks fine. You do a little bite adjustment, they feel better. Then they're back a week later. And, of course, when it comes to my own dentistry, little chips in porcelain or, crowns that just were never comfortable. And now I start thinking, it's not only the x-ray that you need to diagnose what's going on, it's also this tech scan that you need.
Well, in the evidence-based medicine, the literature tells us 2 separate studies that dentists can read those blue dots about 12 to 13% of the time. And so, early in my career, it was always the lab's fault. Mm-hmm. It was a faulty crown, we got to remake it, right? Or the patient would be like, oh my God, just smooth it off, we're good. And so that's a time sink, both for the doctor and the patient to come in and redo something. Mm-hmm. Other than the one migraine that you've had, are there any other symptoms that you feel might be starting to work their way back into your normal daily activities, like
Just the occasional clenching.
occasional clenching? So I will tell you that my experience has been that patients that have been suffering for a while from this, and you certainly fit that bill, become hardwired for pain just due to the neuroplasticity aspect of the brain is never fixed. She's always working. She's always reacting to what's going on around it. Everything you do affects neuroplasticity. Everything you don't do affects it. So, an occasional migraine, 1 or 2 a year, may just be the reality.
Yeah.
But that's a hell of an improvement from 1 to 2 a month
Correct.
that last 2 or 3 days each time. So what we're going to do is I want to hook you back up. I want to see where the bite is. Probably need to do a little bit of revision, but not like New Jersey. It'll be just kind of like a little touch up.
Okay.
And we'll just go from there.
Okay.
Okay.
Sounds good.
Are you still partnering with him?
We're still friends. We're still good.
Good.
He's happy for me because he wanted to see me do my own thing because I was working for corporate. They don't really like me to refer out. Certain things just don't belong
Yeah.
to me.
Yeah.
Like,
No,
I just don't feel comfortable. I don't get involved with the sinus at all.
Yeah. No.
And
Makes sense.
and I don't do impactions and stuff. There's no reason for it.
No,
So,
I agree. Does he know that you are doing this? With the
Not
bite?
yet. He will, because he's been up my tush wanting to place this implant. I don't want to do it because and I explained to him, I said, I have so many problems as it is. I just think if you add a new player, it's going to make it worse.
Sure.
And so he's like, but the longer you wait, the less bone you're going to have there. Because I only got about 7 millimeters of bone or whatever it is at this point. So, and I'm like, okay.
Well, I'll tell you from my end of dentistry and the things that I do, first molar occlusion is absolutely acceptable.
Yeah.
And of course, we do it on dentures, and we do it on some full mouth cases, and we do it on implant cases because we don't, on a full roundhouse implant supported fixed partial, we don't want second molars on there because you're just asking for them to break. Well, why is that? I mean, shouldn't that tooth behave like any other tooth? Well, it is, but the margin for error is much smaller on that tooth because it's closer to the fulcrum.
Yeah.
So unless you're using something like this,
Right.
we're going to do all gold, which is what a lot of prosthodontists do on second molars, because I know it's not going to break. Watch it over 5, 7, 10 years. You're just going to drill a hole in it,
Get a
and the
hole.
patient's going to.
Yeah. I had a gold crown on this tooth. It's
Yeah.
gone.
Right?
So, I asked to have a gold crown. I casted that crown myself at Temple University.
Oh my goodness.
But nonetheless, that tooth's gone. So,
Sure.
and and I know what I'm doing. Upper second molars like that. I got to be careful with my prep, and there's still going to be a chance that the patient's not going to be comfortable and whatever. Like,
Yeah.
I know I want to get this, just for that reason.
For sure. So, Stephanie, you're back. We just checked your bite. We did a couple of more, just a little bit of fine-tuning revisions. Mainly all actually on the right side for you. But I just wanted to get a feel for any changes over the weekend regarding necks, headache, range of motion, pain behind the eye.
I had no problems whatsoever. I wasn't having any problems when I saw you on Thursday, unlike when I saw you in October, and I'm still continuing to have no problems.
Good. Just a couple of questions. Before you saw me in October in New Jersey, what was the longest stretch that you had where you were pain-free from the point that all of this started creeping up? Did you even notice or no?
I never was pain-free for a long time. I mean, probably for a couple of years, there was always something.
Sure.
Between a headache behind the eye, a migraine, some kind of weird tooth symptom that would never be able to be identified on x-ray, or neck pain, or some type of pain
Sure.
in the head or neck.
Did anybody make you a night guard or a buxing appliance or anything like that?
I've had 3 different night guards.
Okay. Did any of them offer you any relief?
No.
They were just there strictly to protect the teeth.
Yes.
Okay. Are you wearing any of those night guards now?
No.
Okay, isn't that interesting? So I have buddies all over in different countries and different parts of the U.S. of every discipline. And my favorite are the guys that say that occlusion is not related to TMD or any symptoms that you're having. So just your experience is particularly interesting for two reasons. One, all we did on you was adjust occlusion and get what we know restoratively should be done right. We didn't do any crowns. We didn't do a full mouth rehab. We didn't build you a piece of plastic. We just fixed what God gave you, right? Or what was artificially moved around with braces or development or whatever. The second thing is you're not wearing an appliance now.
No.
Right. So, and always, you know, your experience is different than most people, and I've treated a couple of dentists, but I mean, you come in with a body of knowledge that says, hey, you know, I've done this and I'm treating my own patients, and now I'm kind of a walking testimonial to how important this technology can be. Because it's not just that you have the technology, you do have to know how to use it, just like a handpiece. Because it can be a wonderful thing, and it can be your worst nightmare if you make the wrong adjustments. So I want to appreciate, let's say I appreciate you sharing your story, because I think yours is unique. But anything else to add before we kind of end here?
I don't think so, no.
Okay. So I don't think I need to see you again.
Not that I don't like you very much, it's just a little far.
It's a little far, for sure. But the reason why I wanted to see you because is an important part of the physiology. Once those muscles relax after they've been tense for so long, that changes. And we're talking about the muscles of mastication, so the temporalis, the masseter, all of those in those family. After they relaxed, the position of the mandible is slightly different. And if it changes a little bit, well, we can introduce interferences that could be problematic, and we can introduce interferences that are not working versus not working. But you don't know unless you measure. So given the fact that what you're telling me, hey, I really have only had one migraine since November, and I was used to having them more frequently, and then some of the range of motions and other things that you're telling me, I don't feel like I need to see you. However, this is the case too. If it's been a number of years that you've been dealing with these symptoms, sometimes patients could be 6, 8, 18 months out, and all of a sudden symptoms start coming back. So if that is the case, because it takes you that long to heal to that point, if that's the case, you know, you don't panic, you just call the office, or you ask me, hey, who in Jersey would you recommend? Is there anybody certified?
I was going to say, can I scan myself?
You can scan yourself,
Yeah.
although I wouldn't trust you to
Adjust myself.
adjust yourself because the
You can't do it on FaceTime.
Yeah, right. I guess we could do robotics. I mean, if you go into where you're on staff there, if they have robotics, I could
No.
log in, right? But it makes a good point. Just that you know, because I've seen that happen, and that only happens about 20% of the time,
Okay.
or 15% of the time. Most of the time, this is stable out, and of the patients that I do this on, they're still in the practice, and I check them once a year, and this is stable, and it's been stable out to 5 years. The literature says 9 to 10, but you know, since bone is constantly turning over, it could change within a narrow margin, but I think we're close enough. I don't think you're going to have really too big of an issue.
Great, thank you.
Any questions for me?
Nope.
Glad you had it done.
Yes, absolutely.
Okay.
I know. My mom's like, this is crazy. I'm like, you know what though? It's the first thing that worked. And I've been chasing a lot of things. I've been spending thousands and thousands and thousands of dollars. So.
And it's so conservative. There are no
Yeah.
drugs. And the guys who built you 3 appliances, all very smart,
Yeah, of course.
all good intentions. none of them measured.
Right.
Because you can still accomplish this in plastic, but if you don't measure,
Yeah.
it's a crapshoot.
And I've lost 15, and that was root canal, re-root canal, which my second root canal was $1,600, and then recrown, lost it, implant removal, 14, root canal by a specialist off the gate, apico, you know, and so.
You had a small fortune in that quadrant.
Yes, exactly. So I'm like, just with that, and then on top of it, Botox, psychiatry, psychology, you know, all kinds of different things when you start factoring all that in, and then I'm like, wow, and it was just my bite. It's like kind of retarded.
Well,
I'm sorry, I shouldn't use that word.
Yeah.
It's kind of silly.
yeah, it is. It is silly, and it's so simplistic. And what if you got it wrong?
Mm-hmm.
I mean, let's just say that you came in and you had the occlusal things that we could see on T-scan. Well, you had some issues too that even if it didn't fix you symptom-wise,
Mm-hmm.
we could eliminate the fact that you don't need new crowns or apicos or endos or extractions because the tooth broke because it was overloaded, like your teeth aren't
Right.
now. And we know that definitively. So even if you were to do it and it didn't work, but it saved you, God, from what you just, that laundry list that
Right.
you just experienced,
Yeah.
that's a ton.
Yeah, different neurologists in New York City, you know, like all kinds of different things.
How long have you been chasing an answer?
Since 2013. And I didn't realize that it's just only after time went by did I figure out that I needed an answer.
Right.
After losing teeth, you know, like after losing 15, which I lost during residency, and which was in 2011. And I just kind of thought, like, man, I have bad luck, you know. And then the pain started creeping into my face and stuff, and it made me start thinking, like, we took classes on this, like one class, one day, you know,
Right.
one lecture about like atypical facial pain, and here I am. I'm not even that old. You think of that as like the old lady, you know,
Right.
like the 60-something-year-old lady, not the 20-something-year-old lady. So I'm like, wow, this is not going well. Like I'm gonna blow my brains out. Like if it continues
Yeah.
on this path. So
Well, especially, you know, it's sad when some patients get to that point, but I can't imagine, you know, I mean, you've been at this for a number of years. Not to mention what it's cost you in lost production,
right,
because you are not razor sharp in your practice or any job that you're doing when you're sitting over there like in so much pain. How am I just going to make it to 5 o'clock?
yeah,
Yeah.
that was lidocaine injections in my face.
God bless you.
Yeah,
Well, thank you for letting me share your story.
Sure, of
I'm
course.
sure it's going to help others.
thank you.